flu epidemic is also an issue in other parts of our area.
Joining us now is Dr. Michael Chang, a pediatric infectious disease expert with UT Health and Children's Memorial Hermann Hospital. You've been here often this flu season, and we thank you for it because you give us really great information. So thanks again for being here again. Okay, so we're well into flu season. What do people need to know about where things stand right now?
Yeah, so we may still be at the peak of activity. We haven't actually seen a significant decrease in activity, and the CDC actually reported maybe a slight increase last week as well. And in Texas, we're still seeing some increased positive testing rates as well as some increased activity. So I would say that I was hopeful we were at the peak the last time I was here, but I don't think we've reached that point yet.
Okay.
Oh, wow.
Well, that's not so good news. So, you know, with so much publicity about this flu season, people have got to be alarmed about what's happening and the deaths. I mean, can you put the numbers in perspective?
Sure. Yeah, I think we don't want to be overly anxious, but we do want to attribute a correct amount of risk to this. And it is a severe flu season. We have seen a report of increased deaths in Texas as well as across the country. I think it is important to remember, though, that when we see that peak in flu activity, that's also when we tend to see the spike in kind of deaths associated with flu. That just kind of makes sense, right? So I think in order to put it in perspective, we're going to have to wait a little bit longer to see if the increase in the deaths that we've seen in the last few weeks that were reported is actually more than previous seasons.
All right. Is it still worth it to get a flu shot?
Absolutely. So even in that last segment, you know, there's risk of other complications associated with flu. And again, you know, we're still at the peak of activity. I think we still have several weeks of the flu season left to go. There's multiple strains of flu that circulate. And so I think if you haven't had a flu shot yet, if you haven't gotten your flu shot yet, I think it would be still a good idea to get one.
And what happens if your kids have the flu or are getting over the flu? What can you do to help them recover?
You know, like we've talked about in the past, the really important thing is just making sure they're well rested, getting plenty of fluids, and that's really the best thing that you can do to help them recover. And when they're ready to, you know, get out and be active, let them do that. You know, you don't want to necessarily keep them inside, cooped up even more. But yeah, mostly it's just rest and hydration.
A lot of people had questions about Tamiflu. In recent weeks, we had reported about some certain side effects that maybe parents didn't know about, hallucinations, that kind of thing. Our viewer Kelly had asked a question on Facebook. She asked, after flu diagnosis and Tamiflu is given, what are the warning signs of sepsis?
Sepsis, well, that's actually a really tough question. So sepsis is more of a kind of an overwhelming response to infection that can actually happen with different kinds of infection, even apart from flu. The main things that you want to watch out for are decreased activity, any kind of confusion, if they start looking like they're or complaining about dizziness, certainly trouble breathing like we've talked about in the past. All of those can be signs of sepsis. The most important ones would be kind of not acting like themselves or acting confused. Those would be reasons to definitely go to the emergency department.
Good to know. All right. Thank you so much, Dr. Chang.
Absolutely.
We always appreciate your help.
And he's not going anywhere either,
No, we
because
don't let
after
him.
this, Dr. Chang will be answering more of your questions shortly on our Facebook page. Also there, in-depth information about symptoms and treatment, and even answers to your general questions on the flu at khou.com.